Everyone. Today we are going to discuss about the infective endocarditis. So first of all, let's discuss about what is the infective endocarditis. So infective endocarditis is an infection, usually bacteria, of the endocardium of heart valves or the mural endocardium. Means it's an infection which most commonly affect the endocardium. What is endocardium? Endocardium is the innermost layer of heart. So as we know, heart has three layers. For example, this is heart. So outer layer is epicardium, middle layer, middle one is myocardium, which is consist of cardiac muscles, and the inner layer which contain the endothelium. This layer, inner layer, is called endocardium. So the infection of this endocardium, which is the innermost layer of the heart, is called infective endocarditis. So it's due to bacteria, that's why we called it infective endocarditis. And what are the sites, most common sites which are involved in the infective endocarditis, which is caused by microbial germs? These are the heart valves. What are those valves? They can be mitral, tricuspid, aortic, and pulmonary valve they can involve. And mural endocardium means the whole endocardium can involve. And the congenital defects, what are the congenital defects? These are the patent ductus arteriosus and coarctation of aorta, so they can involve, these are the sites for the colonization by the microbial agents. And the other less common sites are the aneurysmal sac, blood vessels, prosthetic devices, like we in coronary artery disease, we put some kind of stents, we electrodes in heart block. And what are the lesions produced in this condition? So we will discuss about the lesions which produce in the infective endocarditis. So these are the, first of all, vegetations. What is the vegetation? These are the lesions seen at the site of colonization and invasion. So these most importantly consist of thrombotic debris and organism, like they consist of thrombotic debris and the organism. And the other thing is the destruction of that wall. So underlying cardiac tissue and where the vegetation is formed, they undergo destruction. So these are the lesions produced in infective endocarditis. Then we will discuss about the what are the microbes which is responsible for this infective endocarditis. So these are the bacterial infection, which is bacterial endocarditis, and fungal infection like chlamydia, candidiasis, and also rickettsial infection can cause infective endocarditis. So as you can see, this is the endocarditis valve. So these are the vegetations and destruction of the valves. So as you can see clearly, and this is the endocarditis, which is the inflammation of the innermost layer of the heart. So next, we will discuss about the classification of the infective endocarditis. According to the clinical course, it's acute, subacute endocarditis. So what is acute and subacute endocarditis? So we just pick up only few important points about the acute and subacute. First of all, acute infective endocarditis. So onset is acute, like 1 to 2 days. So onset. And in this acute infective endocarditis, the most important point is infection of the normal heart and cardiac valves involved. So most importantly, normal heart and the normal cardiac valves can involve. So can be caused by highly violent aspirative organism. Most commonly, mainly those organism can involve in this infective endocarditis which are the highly infective. What are those? Staphylococcus aureus and Streptococcus pyogenes. And effective valve is rapidly destroyed by necrotizing ulcerative valvular lesions with death within the 6 week in many patients. So that's why it's very violent and it's acute, so it's very dangerous. And we should uh, keep concern about this patient if the patient present with acute infective endocarditis. Why the patient can undergo death? So these are the reason: acute heart failure and overwhelming sepsis. Why sepsis? Because infective endocarditis can lead to the heart valve regurgitations, and also regurgitation can lead to the heart failure and valves regurgitation, and sepsis because the emboli and vegetation that form in the heart. For example, this is the heart and there is emboli and vegetations can form. So these vegetations can spread to other body system or other body organs, so they can lead to sepsis. So these vegetations can lead to sepsis and can infect the other body organs. So these are the reason uh, in which a patient can undergo death. So then the classification of infective endocarditis, we will discuss about the subacute infective endocarditis. So the insidious onset, it involves structurally abnormal valves. So as we previously mentioned, acute infective endocarditis involve only normal heart, but here is abnormal heart valve involved, like in rheumatic heart disease, congenital heart disease, caused by the organism of low violence organism like Streptococcus viridans and Staphylococcus epidermidis. So important point about the Staphylococcus epidermidis is they produce a special type of biofilm. So through this biofilm, they can attach to any prosthetic agent, like they can cause infection in knee joints when we replace knee with other prosthetic agent, and any stent, any cardiac valve replacement. So they can cause infection there. The lesion are less destructive and protracted course of week to month and typically survive for 6 months, mostly cured with antibiotics. Infectious complications are uncommon. And next, the classification is according to the anatomical location and the causative microbes. Infective endocarditis of the mitral valve due to Staphylococcus aureus. So mitral valve most commonly involve Staphylococcus aureus. Why Staphylococcus aureus most commonly involved, and why infective endocarditis most commonly involved? Uh, Mitral valve, because it's due to the pressure, because the mitral valve is that valve which undergo high pressure, because left atrium blood from the left atrium, like for example, this is heart and this valve is mitral valve, and the pressure in the left atrium is high, so blood rush very speed in with very speed from the left atrium into the left ventricle. So this mitral valve is under high pressure, so that's why due to this high pressure, so the endothelium of that valve can undergo some damage. So due to this damage, the mitral valve can undergo highly infection. So this is the reason why infective endocarditis most commonly involves the mitral valve is due to the high pressure. So next we will discuss about the etiology of. So now we will discuss about the etiology of the infective endocarditis. So it's a infectious cause. So what are those pathogens and causative organisms which can cause an infective endocarditis? Let's discuss about it. Most commonly is Staphylococcus aureus. So what is this? Most in 45 to 65% of the patient, infective endocarditis is caused by Staphylococcus aureus. So if there any case, any MCQs related to the infective endocarditis, the most common pathogen is the uh, Staphylococcus aureus. So you can mention this. Okay. Most common cause of acute infective endocarditis for all organisms include IV users. Because why IV user? Because this Staphylococcus aureus is the most common pathogen and the most common normal flora of the which is present on our skin. So when we do multiple prick through needles, so they can cause infection and enter the blood circulation. And the patient with prosthetic valves, pacemakers, and affect previously healthy valves, and usually fatal within 6 weeks if not treated, because they can undergo the patient can undergo death if they're not treated well with antibiotics. The next is the virulent streptococci, which is the 30%, and streptococcus sanguinis, mutants, and mites. So most common cause of subacute endocarditis is virulent streptococci. Acute infective endocarditis most commonly Staphylococcus aureus, and subacute most commonly caused by virulent streptococci, and mainly the mitral valve involved. So this is the important points and important MCQs which can be asked in any exam. Common cause of infective endocarditis following that any dental procedure is after any dental procedure, there if there is any sign and any and case of infective endocarditis, so this is mostly due to virulent streptococci, and produce dextran that facilitate the binding fibrin platelet aggregation and damage to the heart wall. So this is the reason why streptococcus virulent streptococci can cause infective endocarditis after any dental procedure. So next pathogen is Staphylococcus epidermidis. Infect the peripheral venous catheter. Because why it's in effect? Because they produce biofilms. So for the adherence, like for example, this is the wall, so they produce biofilm and they can easily adhere on wall and form the vegetations on the wall. So common cause of subacute infective endocarditis in patient with prosthetic heart valves and the pacemakers. So this is the Staphylococcus epidermidis. So next one is the enterococci, especially Enterococcus faecalis, which is less than 10%. Multiple drug resistance, common cause of infective endocarditis following the nosocomial, any nosocomial urinary tract infection, UTI infection. So first is UTI. After UTI, 1 week after UTI, if there is any infective endocarditis, so this is most commonly due to enterococci, especially Enterococcus faecalis, and any gastrointestinal and genitourinary procedure. So Streptococcus galoleticus, also previously called Streptococcus bovis. So this bacteria is most commonly associated with colon cancer. So if we suspected this Streptococcus bovis in infective endocarditis in a culture, so we also will do colonoscopy because it's most commonly associated with uh, colon cancer. That's why we will do colonoscopy to check is there any growth, is there any lesion in the colon. Then next group is gram negative uh, Hackey group, so which is Haemophilus species, Agatibacter, Actinomycetum, Cometes, Cardiobacterium hominis, Echinella, and Chinella. So physiological oropharyngeal flora. 3% of cases of infective endocarditis caused by these bacteria. In patients with poor dental hygiene and periodontal infection can be caused by these bacteria. And the next are the Candida species. So Candida is the fungal infection. Fungal infection. So Aspergillus fumigatus. Aspergillus fumigatus cause infective endocarditis in immunocompromised patients. So what are those immunocompromised patients which can be in which these fungus can cause infection, like any diabetic, any immunocompromised who takes steroid, elderly patients, alcoholics. So these are the and children. So these are the uh, um, peoples in which the fungal infection can cause these fungus can cause infection due to their immunocompromised condition, and also the cause infective endocarditis in IV drug abusers, and the cause IV after cardiosurgery interventions, and Coxella burneti Botaniella species gram-negative pathogens responsible for the culture-negative endocarditis. So these are the etiologies of the infective